Hi everyone, my name is Philip and this is the Nurses Heartbeat. So in this episode, we are going to look at 10 high yield NCLEX SATA questions. Select all that apply questions here. Now this is covering a range of different topics. These are part of helping us to really understand how we will go around the SATA type of questions. All right, so let's dive in now. Get ready and answer the questions together with me. So the first question is about diabetes mellitus, DM, insulin administration. So let's look at the question. A nurse is teaching a client with diabetes how to administer insulin. So diabetes, insulin. Which of the following instructions should the nurse include? So you just think of administering your insulin. What are the things that you need to add and the things that are not important you take from it? Okay. So quickly, then you start thinking, okay, insulin. You make sure you rotate the site. You make sure that you will not shake vigorously at the site. We make sure that the insulin, when it is not opened, you put it in the fridge. So a bit of things you can recall about insulin, and if you are teaching somebody or administering insulin, what are the things you will do, the nursing consideration, the precautions. Just a bit of that, you jot it somewhere, and they are going to help you to apply it with the SATA questions. So let's look at the select all that apply they have here. So A, rotate injection site. If you are teaching somebody how to administer insulin, will you tell the person, does it apply? So rotate injection sites. B, aspirate before injecting insulin. Do we aspirate before injecting insulin? No. Okay, so you take that out, and then inject at a 90-degree angle. You know, the insulin, they come with their own small needles, so 90 degrees is fine. We do 90-degree, that is okay. And then D, store unopened insulin in the refrigerator. And then E, rub the site vigorously after injection. Do we do that? No. All right, so just here, before you read the questions or the options, you had just taking note of few things that you have to do when administering insulin, and most of the time some of them will come to the select order apply and you'll be able to eliminate some of them. All right, so let's look at our correct answers here. How many did you get correct? A, rotate injection site, that's correct. And then C, inject at 90 degrees, that is correct. And then you have to store the unopened insulin in the refrigerator, D, that is also correct. All right. Now we don't aspirate before giving the insulin, and then we don't rub the site vigorously. We are going to cause bruises and we are going to increase absorption than expected for the patient. So we don't do these things. Now let's look at 2. Now number 2 is about heart failure. The question is on furosemide. Which nursing interventions are appropriate for a client receiving furosemide? So here, before you even look at the answers or the options, okay, patient receiving furosemide, what are the interventions or what are the things you should consider? Furosemide could cause low potassium, so we will monitor potassium. Why are we administering furosemide? It's diuretic, so we want it to drain fluid. All right, okay, so we want to remove fluid from the body. How we'll be able to assess the fluid status of the body? We will do daily weighing. You see that, and then what other thing can you know from furosemide? If you can think of any other thing, you put it down. Then you look at the options. So the options: A, monitor potassium levels, very key. B, assess lung sounds. Furosemide are normally given in pulmonary edema, pleural effusion, where there is congestion of any of the organs accumulated by fluid. Okay, so when we are giving it, then we will continue to assess the lung sounds of the patient. Okay, and then C, administer potassium supplement as ordered. Now we know that the furosemide will decrease potassium levels, so we can administer supplements to replace it. All right, and then D, encourage fluid intake. Do you think that is necessary? Because the furosemide is supposed to drain fluid, help patient to lose fluid. So are we going to encourage intake? No. And then E, daily weight monitoring. Is it necessary? Yes. All right. So we can see, let's look at the answers that are correct. A, B, C, and E. So monitor potassium levels, assess the lung sounds. C, administer potassium supplement as ordered for furosemide because it leads to low potassium. It's not Spiro. Spiro is potassium sparing. This is furosemide. And then daily weight, they are very necessary. So we have A, B, C, and E answers correct. Did you get that? All right. Now, furosemide is a loop diuretic that wastes potassium. Encourage fluid restriction, not intake in heart failure. All right. Now, the question 3 is infection control. These are targeted to the previous video that we gave, where we said SATA questions normally come under certain topics, and I explained those topics in the previous video. You can watch that if you've not watched before. That is what we are doing. So under infection control, we said look at your PPs, your isolation precaution measures, and you have SATA questions on that as well. So here we are looking at the question 3. A nurse is caring for a client on airborne precautions. Which PPE should the nurse wear? So we know precautions. We have standard precautions. We have the contact precautions. We have the airborne precautions and all of that. So with the airborne precautions, what are the things that we need? So airborne, so we are going to like airborne, like the COVID that came and all other things. What were the things we were doing? So you know that for airborne, you are not going to just wear your normal surgical mask. You use the N95, and then you also make sure you gown yourself, your gloves, and everything. Okay. For normal standard precautions, you will use your surgical mask and your gloves. But airborne, the N95. So let's look at the options they give. A, N95 respirator. For airborne, we will need that. B, gown. So when you are going into airborne zone, all right, your gown. C, surgical mask. Because we are using the airborne, we are not going to use the surgical mask, all right. And then D, the gloves. We need our gloves. And E, face shield if splashing is expected. I think it's correct. Do you agree? So let's look at the answers. A, 95 respirator, N95 respirator. B, your gown. D, your gloves. And E, your face shield if splashing. So like airborne, you position yourself like you were caring for a patient in the COVID era, 2019, 2020 coming, how they were dressed. That is a typical example for airborne. All right. So gown and gloves for contact precautions. So contact precautions, where you are coming into contact with body fluid, you are coming, the patient will see different stuff that can transfer through contact. Then you need your gloves and your gown. All right, good. And then when you are looking at standard precautions, that is where you're going to put your surgical mask and your gloves and your gown. But airborne, we use the N95. So it is important to know the various precaution measures you need to take under which circumstance, and they are applicable in the SATA questions. Question 4, anticoagulant therapy. So this question is under anticoagulation. A client is prescribed warfarin. Which instructions should the nurse include? So a quick idea about warfarin. Warfarin is going to thin the blood of the patient. Is anticoagulant, right? Okay. So we will monitor risk of bleeding. We will make sure that patient is not taking other medications that will cause bleeding. Yes, we know that warfarin, if we want to antagonize warfarin, we will use vitamin K. Now, vitamin K is in green leafy vegetables, all right? So when patient is taking off warfarin, we are not going to give the antagonist substances. So we are not going to give more of green leafy vegetables and stuff because they are going to antagonize the warfarin indication and some of these things. So you note some of these things about the warfarin, then you go to the questions and see the options that are available. So what are the instructions you should give when administering warfarin? So 1, avoid leafy greens. I think it's correct because the leafy greens has the vitamin K, and that is antidote for warfarin. So it will not allow the warfarin to work very well. So that should be correct. 2, report any unusual bruising or bleeding. Very correct. Take aspirin daily for pain. Aspirin is also anticoagulant. It's going to increase bleeding. So when you're taking warfarin, then you are not going to take the aspirin. So that is wrong. You wouldn't recommend aspirin with warfarin. And then D, use a soft bristle toothbrush. Yeah, because of bleeding tendencies, use something that is soft. And then E, wear a medical alert bracelet. Very important to alert people you are on it. So let's look at the answers. The correct answers A, B, D, and E. Avoid leafy greens, report unusual bruising or bleeding, use soft bristle toothbrush, and then wear a medical alert bracelet. So we would avoid things like give more vitamin K substances and then other anticoagulants like aspirin. We will avoid that. Good. Let's look at question 5. It's under pre-eclampsia. So this one, review your content about preeclampsia, and then preeclampsia, we are talking of pregnancy hypertension stuff. What signs indicate worsening preeclampsia in a pregnant patient? That is why we say it is important to review the content so that you know the preeclampsia and things you should note. But what are the signs? Headache. B, visual disturbances. C, proteinuria. And then D, bradycardia. E, right upper quadrant pain. What are the answers? So patient with preeclampsia, what are the signs? Which signs indicate worsening of the preeclampsia? So headache, I think, is fine. Visual disturbances. If you have headache and hypertension, visual disturbances is key. And then proteinuria, okay. Bradycardia, high temperature wouldn't give you bradycardia. I don't have support. And then right upper quadrant pain, E. Okay, so A, B, C, and E were correct. These are signs of severe preeclampsia. Bradycardia is not typical. So here too, if you don't know much about all the signs, you can review the content and it will help you to understand better. That is why content review is important. So let's say, for example, you did not get this question right. I'll go back to, say, take my Sundays and review preeclampsia, know the signs, know about it, and you understand better. That is how we learn when you don't get the answers correct. Number 6 is post-op care. The nurse is caring for a patient post-abdominal surgery. Which interventions promote healing and prevent complications? Patient after post-surgery. What interventions will help? Encourage ambulation, monitor incision for redness, that's assessment, keep patient NPO for 72 hours after surgery. Are you going to keep patient nail by mouth for 72 hours? And then manage pain effectively, encourage incentive spirometry. So which answers did you choose? So you know that all the answers are important except keep patient NPO for 72 hours. After procedure, it is too much to keep patient for another 3 days without food. So the answers are A, B, D, and E. And early ambulation and breathing exercises are very important. Number 7 is under hypoglycemia signs, that's still diabetes. Which findings indicate hypoglycemia in a client with diabetes? So quickly, what are signs of hypoglycemia? Shaking, tremors, sweating, hungry, and those you can add. Okay, so let's look at the answers. Diaphoresis, that's sweating. Yeah, it's a sign. Tremors, okay, if somebody's having hypo. Confusion, most likely. Fruity breath odor, is it in hypoglycemia? No. Hunger, yes. So A, B, C, and E, they are correct. But fruity breath odor is not part of hypoglycemia. Fruity breath odor is seen in hyperglycemia in DKA patient, diabetic ketoacidosis patient. Those are where we find the fruity breath. So that is how you use your elimination to take some answers out and all of that. Number 8 is COPD management. Question: which nursing actions are appropriate for a client with COPD? COPD patients, you know them, chronic obstructive pulmonary disease, conditions that affect their lungs, and they don't need much oxygen requirements, and it's more or less like the asthma patients, you know. So what are the things that we are going to encourage? Which actions are appropriate for them? A, encourage pursed-lip breathing. Good. B, increase oxygen to 6 liters via nasal cannula. 6 liters. Nasal cannula even don't take up to 6 liters. And that will also be too much because patients with COPD, we don't want to give them more oxygen. All right. They are hyperventilating. So we don't want to give them more oxygen. And then provide small frequent meals. Teach tripod positioning. Tripod positioning, patient lean forward and support. You can just put a table before the patient and lean forward and support with the arm or with the table like that. They are very important positions for COPD patient. And then restrict fluid intake. Patient with COPD, we want to give more fluid to thin the secretions and everything, so we don't go into restrict. So let's look at the answers that are correct. A, C, and D. Did you get it? Encourage pursed-lip breathing. C, provide small frequent meals. And D, teach tripod positioning as I demonstrated. We are not going to restrict fluid intake because we want them to drink more to thin secretions, and we are not going to give more oxygen of 6 liters. High oxygen flow can suppress the respiratory drive, so we're not going to do that. And then unless patient is having heart failure where there is fluid restriction, we are not going to restrict fluid for the patient. Last but one question. Delegation to unlicensed assistive personnel, HCS and those people. that do not have the license. What are the things they can do? What are the things they cannot do? Which tasks can the nurse delegate to a UAP, unlicensed assistive personnel? That is why I also said under SATA questions, they are important to know your delegation and your prioritizations, to know which proper ways you can do that. Taking vital signs. Yeah, some of them take vital signs. It's normal for them to take vital signs. Feeding a stable patient. Okay. Administering oral medication. Can your HCA or your unlicensed practitioner give oral medications? We don't do that. And then assisting with ambulation, and then documenting intake and output. So all these tasks, which of them can be delegated? A, B, D, and E. Vital signs, they can take. Feeding stable client. Take note, it's stable client. So client taking oral food and stuff. If your next question, you see feeding patient with NG, it's a red flag because patient is not stable. They cannot do NGs and all of that. All right. So just understand, administering oral medications, they don't administer medication. They can assist with ambulation and they can record input and outtake. The last question, anaphylaxis response. Question: which are your priority nursing actions during an anaphylactic reaction? So quickly, what are the things that happen during an anaphylactic reaction? I know we give adrenaline. I know we want to make sure patient is breathing well. We look at position. Yeah, and a couple of things. If after that, fluids and everything will be prescribed. So let's look at the answers. And under anaphylactic, you are going to apply your ABC, airway, breathing, circulations, to make sure patient is fine. Oh, very important. So administer epinephrine IM, that's adrenaline. You do in anaphylaxis. Maintain airway. Apply cool compress. Will you apply cool compress when patients having an anaphylactic shock? Because it's going to further constrict the vessels. I don't think so. Monitor vital signs, very key. Elevate the head of the bed, yeah, for position, for breathing, and all of that. So A, B, D, E. The only thing that was not part is cool compresses are not part of emergency anaphylaxis treatment. So these are the 10 SATA questions under various topics. Did you realize how we went around each of them? So when the questions are given you, you can just look at the question asked, think about it, jot some points down, about what has been asked, even before you go into the options given. And it will surprise you that you'll be able to just take some of them just like that. My name is Philip. This is the Nurse's Heartbeat, where every heartbeat matters. If you like this video, give me a thumbs up, subscribe to it, and then share. I will see you in the next episode. You are just one way away from passing your NCLEX exams. You are a nurse in the making. See you. Bye.